Some drugstores, especially smaller ones, are struggling because of a shortage of pharmacists because of the pandemic. They're getting sick. Well, now more than 100 Purdue pharmacy students are graduating early so they can try to help fill this gap. Purdue is one of the first universities in the country to certify an entire class to address a potential pharmacist shortage. Let's talk about this some more with Purdue pharmacy student Emily Vaheri. Emily, you are joining us from Fishers. That's where you're from here. First of all, let's get to know a little bit about you. Why did you choose pharmacy? Is this something you've wanted to do since you were little, or did you find it later in life?
So I've always been exposed to the healthcare mentality. Both of my parents are healthcare workers, so I knew I wanted to do something within the medical field. But I found that I was really interested in chemistry back in like 6th grade, and it kind of stuck with me since then. So now I'm here.
Glad to hear you're putting that talent and those skills to good use here. So tell me where you are in your education here, and so how much earlier does this set you on a path where you can actually be working as a pharmacist?
Yeah, so our original graduation date was May 17th. So now we're actually graduating tomorrow, April 17th. So it's about a month earlier than we had all initially planned. The nice thing about graduating earlier is that we kind of have a leg up on starting our licensure requirements and getting our exams done. So that allows us to be able to be pharmacists almost a month to 2 months earlier than maybe some of our counterparts in other pharmacy schools.
So tell me what it is that you, are allowed to do as a new pharmacist. Are you fully vested here? Do they give you all of the ability to do everything that a pharmacist who's been on the job for years can do, or there are some limits about what you are allowed to actually do in the industry?
Yeah, so I think it depends kind of where you are working in the industry. I know I've worked in retail pharmacy for several years. So a lot of the privileges that I have as an intern are the same that a pharmacist would have. But as you graduate, you are able to actually physically check prescriptions, which is a very large bulk of what pharmacists do in the retail setting.
Well, this is a lot of, fellow students that you have that are entering the workforce now. When will you start, and do you know where you'll be, and will it be something that's permanent or temporary for you?
Yeah, so my next step is I'm excited that I'll be completing a PGY1 residency at the University of Iowa Hospital. So I'll be starting that in June. And basically what that is it's a 1-year program that allows me to specialize more in the hospital setting of pharmacy. So I'll be able to continue my education, but as a licensed pharmacist, which is really cool.
Let me ask you, starting when you're starting, this is such unprecedented times and we're all taking precautions. Do you have any nerves or thoughts, misgivings about being in the public in such a precarious way, or do you feel comfortable with all of the protections in place?
I think that there's always going to be some sort of nerves with being in this type of situation. But I know even in my retail job, we are given a lot of personal protective equipment. We try to take as many precautions as we can. And I try to take as many personal precautions that I can as well. So yeah, there are some nerves, but you try to you have to try to stay positive in these times. I think that this will be a really good learning experience for me and my classmates as well, going into this at the beginning of our careers, because what we learn from this whole situation could potentially help us to prevent something in the future.
Well, Emily, it was good of you to take the time to talk with us. Best wishes there in Iowa. Good luck, and you take care of yourself and maybe stay in touch, okay?
All right. Thanks so much for having me.
All right. Take care. 9:26.